Good afternoon. Welcome to National Level Online Short-Term Course on Life Skills for Women in COVID-19. Today's topic is protection and prevention of occupational eye hazards and injuries in various industries. I am Dr. Kumara Swamy, consultant ophthalmologist at Nayana Hospital, Dharwad. Before I go deep into the topic, I would like to highlight the importance of eyes, vision, and sight. Eye is the vital organ of vision, which is most highly developed sensory organ in the human body. It plays a very important role in one's life. It gives us the sense of sight, allows us to learn more about the surrounding world than we do with any other four senses. The eyes allows us to see and interpret shapes, colors, and dimensions of the objects in the world by processing the light they reflect or emit. Good vision contributes to improved athletic ability, better driving skills, improved learning and comprehension, better quality of life. The eye is able to see in bright light or in dim light, but it cannot see objects when there is no light. 80% of the knowledge we get is through our eyes. Eyes can capture and interpret more than 1 million pulse signals per millisecond and transmit to the brain. The human eye can differentiate approximately 10 million different colors. Our eyes are truly amazing organs. Healthy eyes are a critical component in learning and experiencing growth and development. Our eyes, like other organs of our body, are subject to stress and injuries and can lose their full potential if not properly taken care of. It's important to maintain the health of our eyes even as we grow. Leading a healthy lifestyle of exercise and proper nutrition can help us to keep our eyes functioning properly well into our later years. Most people don't start thinking about eye health, don't take care of their eye health until they experience some change in their eyesight. Our eyes are like other organs in our body, they change as we grow older. Keeping them healthy when we are in our 20s and 30s will prepare us well for age-related changes that begins in our eyes. I would like to show you a short video about the structure and function of the eyes.
Structure and working of the human eye. Nature has located the eye close to the brain so that its messages may arrive there quickly. The eyeball is completely surrounded by a layer of soft, fatty tissue and placed within a bony orbit where eye is protected. Seeing from inside, the protected position of the eyeball within its funnel-shaped eye socket is shown still more clearly. Note that this is a white stalk called optic nerve which connects the eye to the brain and also these muscles which move the eyeball. This is the empty eye socket within the skull with its bony wall inside and a bony orbit in front. The capsule of the eyeball seems to have 3 layers. This thick, tough outer layer is called the sclera and serves to protect the delicate structure within. This transparent bulging portion is called the cornea. There is also a crystalline lens which is one of the main parts of the human eye. The second layer is called the choroid. It consists of 3 different zones. The first zone is called choroid proper and it is the part that carries nourishment to the tissues of the eye. The next zone is called the ciliary body. This is the broad ring-shaped band of thin muscle fibers which plays a very active and vital role in the vision adjustment of the eye. The third zone is a well-known iris which expands and contracts the pupil much like the diaphragm of the camera. The innermost layer of the eyeball is the retina, a very delicate membrane. The retina is actually the part of the optic nerve which transmits the light impulses to our brain. The retina is the most important and complex structure in the eyeball. It consists of a complicated arrangement of rods and cones which convert light waves into nerve impulses. Between the lens and the cornea is the aqueous humor, consisting mostly of water and a little salt. This largest space within the eye is filled with vitreous humor, consisting chiefly of water mixed with salt and albumin. It is a highly transparent jelly-like substance and plays a very important role in visual adjustment. The reflected light of the world enters through the crystal transparency of the cornea, pupil, aqueous humor, lens and vitreous humor, which is a clear gel-like substance that fills the middle of the eye and then projects on to the photoreceptors of the retina, which is a photosensitive tissue lying at the back of the eye. The macula is a very small area at the center of the retina that gives us a fine pinpoint center of vision. The area of retina surrounding the macula gives us a peripheral or side vision. The retina converts the light rays into the signals that are sent to the optic nerve and then to the brain. Continual adjustment of the pupil and lens regulates the entry and focusing of light. Every blink helps our eye's natural defense system. The tear film retains moisture and maintains visual acuity. Tear gland secretes the tear fluid, which contains important natural disinfectants to keep bacteria away, and it drains through the tear duct into the nose after flushing and cleaning the entire eye surface, and thus the tear system washes away impurities to maintain eye health.
In ancient times, when human beings lived in forests, their primary occupation was hunting, and primary visual need was to look at distance to hunt in an effort to arrange the food for life. But present occupation confines us to tables and chairs, working on computers and spending most of our time within a small boundary of office. The change has its effects on the primary visual demands. The distant dominant world of ancient time has completely changed to near world in the present era. Just look at these two eyes. Nobody can identify which is the healthy eye, which is the unhealthy eye, because both looks alike. So nobody can spot eye disease just by looking at the eyes. You should not wait for symptoms. Get your eyes tested. About 87% of people over 45 years have at least one eye problem, but up to 80% of this visual impairment or blindness can be prevented by early detection. So get your eye tested after 40 years. Protection and prevention of occupational eye hazards and injuries in various industries. Each day, more than 12,000 Indian workers have a job related eye injury that requires medical treatment. Eye injuries are common in all industries, but workers in construction, mining, agriculture, manufacturing have a highest rate of eye injuries on the job. Men have 80% of work related eye injuries. Among workers treated in an emergency department, men had an eye injury rate 4 times higher than in women. Workers less than 45 years of age have an eye injury rate almost 3 times higher than of the older workers. Why should we be concerned with this eye safety and eye injuries and occupational hazards? 10 to 20% of these eye injuries result in temporary or permanent vision loss. 3 out of 5 people in whom eye injuries occurred were not wearing any eye protective device. That is, about 30% were without any eye protective device or eye safety device, which is highly unacceptable. The other 40% who were wearing the eye protective device were wearing the wrong eye protective device, which was not suited for their working conditions and working environment. What are the major priorities in occupational eye health is it is to prevent work-related eye diseases, injuries, and vision disorders, and also to enhance the performance of the workers on the job. Occupational eye hazards depends on so many factors, the main being the worker's eye and his visual system, the nature of his work, and also the working environments. Occupational eye hazards can result in traumatic injuries or maybe due to harmful exposure to various liquids, gases, chemicals, or the worker himself may be having some uncorrected, undiagnosed ocular disease leading to occupational hazards and eye strain and fatigue, common in computer information technology industry. It may be due to miscellaneous other ocular complaints as well. Now, looking at the types of eye hazard which can occur in industry, it may be due to flying objects. Flying objects in the air can hit the eye and penetrate the eye also. Particles and dust in the working environment. Chemicals used in many chemical industries, dye industries, soap factories, fertilizers, etc., etc. And in many harmful radiations, which may be ultraviolet rays, infrared rays, or due to lasers. The most prevalent sources from which our eyes may be damaged may be due to small particles, especially scrap materials, waste, wind-blown dust, forceful impacts, flying material particles, or slivers from wood, metal, plastic, or cement can forcefully impact on our eyes. Chemicals and chemical products, liquid, molten metals, vapors, gases, etc. A falling or a misdirected objects, or maybe due to a UV light from the welding torches and sunlight. Other, other causes may be due to heat, lasers, and radiations. These are multiple pictures showing the sources of eye hazards, like in grinding industry, woodworking industry, sanding industry, sandblasting, nail gun use, blowdown industries, and in some industries where there are harmful light radiations, like in ultraviolet rays from welding, infrared rays from molten metal, and lasers, etc. We can study occupational high hazards and their effects by studying various eye problems, occupational problems in various industries and in different occupations, like in eye problems in industries, agriculture, sports, driving, cooking, and healthcare workers. Occupational eye hazards can also be broadly classified as, depending on the nature of the hazard, like it may be a mechanical hazard, wherein there is a causative agent is the flying objects, or it may be a contact with fixed objects, dust and powders, hot solids, or due to chemical injury, maybe due to dust and powders in the atmosphere, liquids, hot liquids, droplets, splashes, vapors, fumes, gases, radiation injury from glare from visible light, short circuit electric arc, ultraviolet rays, infrared rays, laser sources, or a combination of these may be present in the working environment and cause occupational high hazards. Small particles can damage our eyes. Small particles can become airborne and lodge themselves into our eyes. These particles can cause bleeding of our blood vessels of the eyes, or it may cause a blurred vision. It may cause sensitivity to light called photoophthalmia, and the patient and the worker may not be able to open the eyes in the bright light. Most of these injuries will not cause permanent damage if treated immediately. If a small particle is stuck in your eyes, you have to try to guide it out by blinking, not by forceful blinking, but with a milder blinking. If you cannot guide it out, you have to consult an eye surgeon immediately. But at any point of time, you should not rub your eyes. Forceful impacts can also damage your eyes. Objects that hit our eyes with a forceful impact come in many shapes and sizes. These impact can create a black eye, rupture the eyeball, break bones around the eye, or push the eye back into its socket. You should consult an eye surgeon immediately if bleeding does not stop or the vision is blurred. Use of eye packs can reduce the swelling, and applying of warm cloth can absorb the blood. Uh, Try to avoid medications with aspirin or any painkillers. Mechanical hazards, it compromises the it's the most commonest hazards seen in almost all industries. It compromises about 70 to 80% of all work-related eye injuries. The severity depends upon the missile size, mass, speed, and that is involved. A slow-moving missile may cause a contusive or a concussive injury to the eye and adnexia. Contusion results from direct blow to the eye, but a concussion arises from conduction of energy from a remote site to the target tissue. Missiles with rough surface or sharp edges can cause laceration and abrasions of the eyelids as well as the eye. Or a foreign body is in the eye. It may be a superficial or embedded or intraocular. It all depends on the size, shape, and speed in which the foreign body gets impacted over the eye. An iron or a ferrous foreign body should be removed as quickly as possible to prevent siderosis. Siderosis is a condition in which there is a formation of rust in the eye tissue as a result of oxidation of iron contained in the foreign body, and at a later stage it can lead to complete blindness. Particles less than 0.5 millimeter of diameter are too small to cause any penetrating eye injuries. It may become embedded on the eye surface and can cause foreign body sensation upon contact with the eye. Next, we'll go to chemical hazards, which are more dangerous. Chemical hazards may be due to an alkaline solution or an acidic solution. Alkaline solutions penetrate the eye rapidly by saponification of cell membranes and cause more severe injuries than acids of the same concentration. Acid causes coagulation of proteins of the ocular tissue, which acts as a barrier for further penetration. So, chemical injury by alkalis are more dangerous and more harmful to the eyes than an acidic chemical injury. Chemical damage to the eyes may be due to it can cause chemical burns from the liquid, gas, or vapor. Exposure to chemical substance can cause irritation, temporary or permanent damage to the eye, or it can also cause blindness. The severity of the injury is influenced by the length of time the chemical is in your eyes. These are the various features of chemical hazards to the eye. This is the severe acidic injury, alkaline injury. This is a severe alkali burn, final result of a severe alkali injury where the cornea is completely opacified and the patient is blind. This is due to severe alkali injury in which the worker has undergone keratoplasty to restore back his vision. The most common chemical injury is due to alkali. The commonest alkali is ammonia, which is used in fertilizers and refrigerant industry, or lye, which is used as drain cleaners. And it may be due to lime, which is used in building industry like plasters, mortar, and cement, magnesium hydroxide in sparklers, potassium hydroxide in caustic potash. The most commonest acid which is noticed in occupational hazards, or sulfuric acid used as industrial cleaners and as a battery acid, hydrofluoric acid in gas polishing and glass frosting, gasoline alkylation, acetic acid in vinegar, sulfurous acid in fruit and vegetable preservative and bleaches, etc. How to treat eye injuries from chemical burns? The first 10 to 15 seconds are most crucial and most critical. You should wash your eyes for more than 15 minutes using an emergency eye wash equipment. If the emergency eye wash equipment is not there in the industry, one can wash the eyes for 15 minutes with a clean, safe water. And you should immediately see an ophthalmologist as early as possible to prevent further damage and for further treatment. Electrical hazards seen especially with electricians and in electrical industries. It can cause damage to the central nervous system, and in very rare cases, an electrical cataract may be observed. Effects of eye radiation. Effects of ultraviolet radiation. Can cause photoophthalmia, photokeratitis, or photoconjunctivitis. Photochemical damage to the corneal epithelium. It results from absorption of UV light of wavelength 300 nanometer and below. It can cause structural changes when exposed to repeated long continued exposure of UV radiation. It can cause pterygium pengicula band-shaped keratopathy. The cumulative effect of UV radiation can cause cataract, and this is mainly caused by ultraviolet B radiation, which is of 290 to 320 nanometer. Normal levels of visible light are not hazardous. Unusually high levels of visible radiation can cause both photochemical and thermal injuries to the retina. Short wavelength cause photochemical damage. Longer wavelength can cause both photochemical and thermal damage. Occupational eye problems in sports. Sports. Sports is a physical activity carried out under an agreed set of rules with a recreational purpose. It may be for competition, or as a self-enjoyment, or as a combination of these. American Medical Association classifies sports as collision sports like football, hockey, rugby, or a contact sports like baseball, basketball, wrestling, boxing, non-contact sports like running, tennis, swimming. Others are aiming sports like bowling, golf, and archery. On the basis of potential for eye injury, sports can also be classified as low risk sports, high risk sports, and very high risk sports. Low risk sports is one in which there is no use of ball, bat, mitt, racket, stick, and there is no body contact. Examples are running, swimming, cycling, gymnastics, etc. High risk sports in which there is a use of ball, bat, stick, racket, and there is a body contact. For example, hockey, football, basketball, racket sports, tennis, golf, etc. A very high risky sports are boxing and wrestling, where there is a contact. It's a contact martial arts. In these high risk sports, eye protectors are typically not worn. The common mechanism of eye injuries in sports is due to blunt trauma, penetrating injuries, or radiation injuries. The main purpose of sports eyewear. The sports eyewear protects the eye from ocular injury and UV radiation. It provides proper vision so that the wearers can continue to perform with least discomfort while getting the right level of protection. Use of polycarbonate Revex NXT lens materials can provide superior impact resistance over glass. CR39 lens materials. Glass lenses should be avoided. Light frame frames but resistant to strong impact fitted with an elasticated sports band is the best as a protective eyewear. However, the frame construction does not withstand the forces encountered in many sports. frame should be made of impact-resistant plastics, preferably polycarbonate. There are two types of protective eyewear. They are goggle style or a shield style protection attached to a helmet. The uses of filters and performance eyewear, sun eyewear. Higher level of solar radiation in outdoor sports saturate the photoreceptors and reduce finer level of contrast sensitivity. Properly selected filters reduce glare and improve contrast. This enhances the ability to differentiate the crucial details and judge the depth. Protection from light radiation is directly related to the filter lens density. One should select the darkest shade that allows the task performance. It should also protect from UV exposure. The use of contact lens in sports. Contact lens is a choice of refractive correction in highly dynamic sports like basketball, baseball, football, skiing sports, volleyball, gymnastics, etc. A soft lens with UV absorbing tints protect the ocular tissues covered by contact lens. It provides the best protection when used in combination with quality sun eyewear. In aiming sports like shooting and archery, spectacles are preferred over contact lens. As in contact lens, spectacle. In aiming sports like shooting and archery, spectacles are preferred over contact lens, as peripheral vision do not affect the performance. Contact lens movement on the eye causes undesirable visual fluctuation on prolonged gaze and decreases contrast sensitivity. This is a picture depicting the disadvantages of goggles and which are largely taken care of by contact lens over the eyes. The goggles causes visual field restriction, optical distortion. It may also cause frame discomfort, surface reflections, and lens fogging, frame instability. These are completely avoided by contact lens, which moves over the eye with the eye. Occupational eye hazards and eye problems in driving. Driving can be defined as the ability to operate, control, and direct the course of vehicles. Normal visual functioning is an essential requirement for driving. Drivers need to be able to judge the distance, read road signs, and assist driver to respond to changes in the environment quickly and efficiently. A good visual acuity, in addition to normal visual field, good stereopsis, normal color vision, eye coordination, good retinal adaptation are essential to avoid road traffic accidents. As driving is an outdoor activity, drivers are exposed to high level of ultraviolet radiations, dusty and windy environments. Protective eyewear for drivers. For daytime driving, sunglasses that transmit less than 67% of incident light is to be used. Sunglasses that provide 100% UV protection. That is, the glass that protect your eyes from both ultraviolet A and ultraviolet B radiation should be used. The tint of the lens has nothing to do with UV protection of the glass. A clear lens with no tint and 100% UV protection is better for driving than dark, heavily tinted sunglasses without UV protection. Dark lenses without adequate UV protection are actually worse than not wearing glasses at all, because the dark tint causes your pupils to become dilated, thus exposing your eyes to more harmful UV light. Yellow, green, brownish lenses impair color vision significantly due to sensitive shift in the spectral transmittance of the light through the lenses. So, tinted glass lenses are not recommended for drivers. While polarized and anti-glare lenses may offer better image clarity, a more comfortable viewing experience give you better vision when driving or playing sports, but they have nothing to do with UV protection. This is a picture depicting the vision without polarized glass and with polarized glass. With polarized glass, it reduces reflection from wet road and snow, and clarity is more clear. For night driving, only the lightest tint should be used. Anti-reflection coating on the lens with lightest tint maximize the transmission of light into the eyes. Poor illumination at night and use of tint can further reduce illumination, which is unsafe for driving. Occupational eye problems in agriculture. Agriculture includes crop farming, livestock rearing, and fishing. Most of the agricultural works are outdoor and involves use of agricultural tools, fertilizers, insecticides, and pesticides. The main causes of agriculture-related eye problems are a direct trauma with the agriculture tool, vegetable, plant, organic materials hitting the eye, chemical injuries by pesticides and insecticides, animal attack injury, cow horn injury, insect sting, etc. Soil spillage into the eye, other foreign bodies in the eye, constant exposure to wind, dust, allergen, and to UV lights. Protective eyewear in agriculture. One can use sunglasses, safety glasses wrapped around the lenses, goggles, it protects from front and side impact, or you can use a full face shield. Eye infection hazards in healthcare industries. Infectious agents may enter the body through eyes, nose, and mouth. The use of eye and face protection is required in the healthcare industry during procedures that may generate body fluid splashes and sprays. Healthcare professionals should always take universal safety precautions in handling infectious materials. Eye protection may also be needed to protect against exposure to infectious agents, sewage treatment industry, composting activities, and during application of biosolids. Kitchen safety, eye safety tips. The most common workplace is kitchen, especially for females. Here are some of the few eye safety tips. Wash your hands after every task. Risk of eye injury due to fall of hot oil, other cooking liquids are always there. So always close the hot pan when you are cooking oil or liquids. Eye injury can occur due to use of sharp culinary tools. Risk of eye injury can occur from steam due to cooker burst, etc. Eye injuries can also occur due to insect repellents and cleaning products. You should not use food as medicine. The kitchen or the working place should not be slippery as it may cause falls, slipping, and cause eye injuries. Everyone should take precautions while cutting onions. One should label all the items in the kitchen so that it is easily identifiable, and use durable and leak-proof food containers. How to reduce workplace eye injuries? The precautions to be taken by employers and employees. Proper selection and use of eye and face protection will help to prevent eye injuries. Ensure that appropriate eye protective devices and measures is available at the work site. Keep bystanders out of work areas and or behind the protective barriers. Use your tools properly and keep them in good working order. Use caution flags to identify potential hazards such as hanging, protruding objects. The worker should wear the provided protective eyewear whenever he is required, or it's better if the protective eyewear is worn immediately when he enters the uh, work area. Everybody should comply with eye hazard sign, and everybody should undergo vision testing at least once in a year. Pre-employment, and once in a year. The given protective eyewear should be maintained in a clean and a sanitary condition. Eye and face protection standards. Eye safety wear must have Z87 or Z87 plus mark on frame, and in some cases the lens also. Safety eyewear with polycarbonate lenses offers the highest impact resistant and greater eye safety. It will be marked as Z87 plus. Protective eyewear should be properly fitted and it should be comfortable to wear. When other personal protective equipment such as half-face respirators required, protective eyewear must be selected to fit so that both types of personal protective work equipment work properly. Types of eye protective devices. The proper type of eye protection must be selected to match the type of hazards. The examples of eye protective devices are as follows: safety glasses with sight protection or sight shield as shown in the figure, goggles, face shields, welding helmets, full face respirators. As I told you before, there are three main types of eye protective device: safety glasses, goggles, and face shields. Safety glasses are most widely used, stronger than the regular side shields. It should be equipped with the side shields. Non-prescription and prescription safety glasses are also available. It should have a lens coated. It should be Z87.1 approved. The safety glasses can withstand impact of a quarter-inch ball traveling at 150 feet per second. The safety glasses guards our eyes against forceful impacts and heat. One should ensure proper fit and it must be comfortable if worn for long periods. Goggles. Goggles provide more protection and secure shield around the eye than safety glasses, especially from flying particles. It should be impact resistant when used for flying object protection. The special lenses in the goggles can protect against bright light as well. It provides protection while handling corrosive liquids, irritating gases, and vapors. When worn over the contact lenses, in areas of dust and chemicals, one should wear goggles over the contact lenses. Goggles, few goggles or special goggles are provided with vent or coated to prevent fogging. One should ensure proper fit of the goggles. Full face screen, face shields and helmets provide full face protection. It guards against liquid metal, molten metal, chemical splashes, or flying particles. It can be used with a hard hat. One should wear goggles or safety glasses underneath the face shield. It will not protect against the forceful impacts. Welding sheets protect our eyes from intense light and ultraviolet radiation. Special shields are available for infrared rays and ultraviolet lights. Welding helmets provides face and eye protection. It has observative lenses which filter intense light. It should be used for all electric arc welding, and a welding helmet equipped with the correct shade filter is required for this purpose. Many welders are now using auto darkening welding helmets. It should be used along with safety glasses. Laser eyewears, this is used in laser industries, where it protects the eye from getting injured by lasers. You should protect your eyes as well as those around you. Never remove your protective equipment that guards you from airborne particles. Inform co-workers of the situation that could damage their eyes. There is no excuse for not wearing the proper protective eyewear. The other protective measures which can be undertaken in a working place environment: machine guards. The machine should completely surrounded by guards like the lathe machine, grinders, and sanders, so that nobody gets injured by the machine. Work area barriers screens the guards, sting, and sanding. Ventilation or hoods for handling shields and screens on the machine. One can use welding curtains or barriers. Other barriers should be used like grinding and cutting chemicals. There should be good ventilation of the working environment and also good lighting. There should be signs and warnings about the hazards in the working place. An emergency eye wash station is required in every working place in case of potential eye exposure to corrosives, acids, caustics, strong irritants, toxic chemicals, pesticides, and others. Eye wash station flushes eye with water for 15 minutes. You should hold your eyes open with fingers and look into the water stream. You should not rub your eyes. After immediate first aid flushing, you should better seek an ophthalmologist consultation. One should follow safe work practices. You should read and follow all warnings and precautions that are placed in the working place environment. You should not throw tools or participate in horseplay. The sharp and pointed tools should be kept away from eyes. One should take care of the personal eye protective equipment. Protective eyewear will not withstand repeated impact or abuse. One should replace the glasses when lenses are broken one or when you cannot see through them for any reason. The knotted, twisted, worn, stretched out goggle strap should be replaced. You should clean the protective equipment after every use. You can clean the same with mild soap and water or a special wipes designed for protective eye equipment. Never use abrasive soaps, rough paper, or cloth towels. Always keep in the good working condition. If damaged, repair or replace. Store the eye protective equipment in a sanitary, cool, dry area away from moisture. Eye injuries first aid. Never rub the eyes to remove particles or if the eyes are irritated. For chemicals burns, flush with fresh, cool, safe water for a full 15 minutes. Then report to eye emergency department as early as possible. For puncture and eye trauma, cover the eyes gently with a soft cloth and get medical treatment urgently. Report all minor cuts and eye problems to a medical treatment facility. A minor scratch can lead to an eye infection, possibly causing scar tissue and loss of sight. Summary: false sense of security is dangerous. Every year, thousands of people are blinded from work-related injuries. The most common injuries are from forceful impacts, chemicals, and small particles. There is no excuse for not wearing your protective eyewear. Self-medication can cause visual loss and adverse effect on other organs. Majority of occupational eye hazards are preventable. All protective eyewear have certain limitations. Proper selection of protective eyewear, depending on the nature of work and working environment, helps in prevention of potential eye hazards. The elimination of avoidable blindness is an achievable goal. It is something we can do and we should do. When you work, wear your eyewear and protect your eyes. Otherwise, you will lose sight and you will lose everything. Thank you for giving me this opportunity to briefly tell about occupational eye hazards, occupational eye injuries, various industries, and how we can avoid blindness. Jai Hind, Jai Karnataka.